Dolores Chalmers' heart is working at 15% capacity.
I could only walk maybe 10 steps without really getting really tired and breathing hard.
All Dolores wants is a normal life.
Like driving and going places on my own.
Millions of people are affected by heart disease, and many are searching for information to become partners in their own health.
In the news about, taking control of your blood pressure, taking control of your weight, trying to exercise. But not until it happens to you or someone you know, a friend, a family member, do you really realize that, oh, this is really a serious issue.
It can happen to anybody. There's no question heart disease is the #1 problem in America.
My heart, out of nowhere, it started beating and squeezing as fast as you can imagine. I remember laying there thinking, this can't be happening.
In the United States, 1 in 2 men and 1 out of every 3 women will eventually develop heart disease during their lifetimes.
Sharp pain, and it was just like completely constant.
Half of us die from this disease. 80% of us die with it.
I had no warning until I had my massive heart attack.
It is a magical organ. Even from the time of the ancients, the heart has been viewed as the seat of the soul. And many art forms have referred to the heart through the millennia, thinking of the heart as being a reflector of many emotions.
Felt terrible, lost my appetite, lost probably 22, 23, 24 pounds. My legs started to swell up. It's quite a change.
All his life, Tom had been the picture of health. He never had any signs of heart disease until it was so serious that it was untreatable.
It's common that patients will present with a very advanced disease, and they've never really known they've had coronary artery disease in the past. The body is capable of compensating over prolonged periods of time to basically make up for compromised function.
When we're excited, when we're in love, when we're frightened, our heart speeds up and thumps like it's going to jump out of our chest.
No heart, no heart, all hollow.
And the heart figures very prominently in many songs.
I could stay young and chipper, and I'd lock it with a zipper, if I only had a heart.
The heart soldiers on for decades without our giving it a thought. But then it can be the root of our demise in just a fraction of a moment.
And once every minute, someone dies.
Heart disease is the #1 problem in America. Disease of the heart and the blood vessels is responsible for up to half the deaths in America. So think about it. You take all other causes of death combined, and they just equal heart disease as a cause of death.
The vast majority of us, by the time we reach a fairly ripe age, have advanced atherosclerosis in our blood vessels.
I need nitro and heparin.
And when you have the diagnosis of coronary heart disease, it's a diagnosis you carry.
Preventive cardiology didn't exist when we started. And I think that's the concept that we had to get across, that you shouldn't sit and wait for the catastrophe to occur. You should head it off at the pass.
In order to do that, they would have to figure out the relationship between heart disease and risk factors. From the 3 that have been identified, high blood pressure, high cholesterol, and smoking, the first one the doctors studied had previously been seen as no threat at all.
When Framingham began collecting information on blood pressure, there was almost nothing understood about the risks associated with high blood pressure. And many people at that point in time really held firmly to the belief that rising blood pressure was part of the normal aging process.
At the time, medical students were taught that blood pressure that went up with age was the body's way of compensating for what was thought to be a normal narrowing of the arteries in the heart. They even gave it a reassuring name: benign essential hypertension.
Now, the term benign essential hypertension had a connotation, namely that it was not terribly important and that it was essential for people's blood pressures to go up as they got older in order to perfuse their organs through narrowing vessels.
Before the Framingham study, the reasoning was that if you were 40 years old, for example, your blood pressure should be 140 over 90. At age 50, it should go up to 150 over 90, and so on. As high as 170 or even 180 over 90, depending on how long you lived. The Framingham study, however, released a stunning new finding that told a completely different story. Blood pressure that high was an enormous risk for heart disease.
High blood pressure is really a silent killer, because if it goes untreated for a long period of time, it will increase the likelihood that you'll develop a stroke or heart failure or other forms of heart disease.
No one had ever proved a direct connection between high blood pressure and heart disease before. And even more significantly, the researchers were also able to prove the other side of the equation. People with low blood pressure had a lower risk of heart attacks.
It was then that new drugs began to emerge for the lowering of blood pressure. And with time following these people, looking at who went on to develop cardiovascular disease, it began to become perfectly clear that lowering high blood pressure reduced the risk for heart disease.
It was a discovery that turned the medical world of 1965 upside down. For the first time, there was proof that something specific, keeping blood pressure low, could prevent heart disease. This landmark finding would open the doors to an entirely new approach to cardiovascular research.
Welcome to Mini Medical School. I have to tell you, the real medical students do not applaud when I come into the lecture room. They're usually reading the newspaper. We're going to start with a quiz, and then we're going to have another quiz at the end of this lecture. The first quiz, though, I think is relatively easy. Do you know how many heart surgeons it takes to change a light bulb? Just one. He holds it, the world revolves around it. The second quiz is going to be a little bit more important, and it's going to be a little bit harder. What are the symptoms of heart disease? This is an important one because your life may actually depend upon it. Now, I'm going to ask you to cooperate for a minute. I want you to take your hand and put it over your heart, just like you're saying the Pledge of Allegiance. For 99.9% of you, it's off on the left side. Now, I want you to think about this for a second. In this country, every 33 seconds, someone dies of heart disease. Their heart stops. That means that during this lecture, about 60 people are going to die of heart disease. This is a huge problem. We're here tonight to talk about something that really is going to be important for all of us watching this. Your heart is basically a pump. Every time your heart contracts, about 2 to 3 ounces of blood are pushed out of your heart. This is the left ventricle, which is the main pumping chamber of the heart. When your heart beats, not every single drop of blood comes out, usually about 2/3. So we talk about an ejection fraction of about 66% being normal. This is a very remarkable pump. It pumps about 1 to 2 gallons of blood every minute. So every day, your heart will be circulating very quietly through your body about 2,000 gallons of blood. Tonight we're going to meet 2 patients, and they're going to put a face to these millions of people that have heart disease. Our first patient is going to be Mr. John Hernitz. Mr. Hernitz is a 65-year-old man who'd had 3 heart attacks. He'll tell you how he felt.
Smoking will get to you. 50 years I've smoked 3 packs of cigarettes a day. And this is what I got. notice I'm not too undernourished. Probably eat the wrong stuff too. I couldn't even walk across the yard. Couldn't bowl, couldn't play golf, couldn't get the boat in the water. Simple things, you take for granted. It wasn't there.
When you have this type of blockage, you can have several symptoms that will develop. Sometimes it's silent, and you don't even know you have it. But if you have symptoms, it may include things like chest pressure or tightness. Some people actually have told me they thought they had an elephant sitting on their chest. I don't believe them, though. Other time, people talk about having chest pain or indigestion with this. Also, patients can become short of breath. They get winded easily. They get tired very easily. When the blockage progresses, it can cause a heart attack. Plaque here, which is atherosclerosis or hardening of the arteries, when that plaque ruptures, it can form a blood clot. When that happens, it stops all the blood flow going downstream to the rest of your heart. What happens is that the heart muscle then is damaged. You have a heart attack. Cardiovascular disease is a huge problem in the United States. It is far and away the #1 killer in this country. It causes almost 1 million deaths per year, and this is not just a disease that affects the elderly. Over 150,000 deaths occur in patients less than 65 years of age. This shows an MRI scan of the heart. On the left-hand side, we see a normal heart. It's contracting pretty vigorously. Over on the right side, we see the heart for Mr. Hernitz, our patient that we'll be talking to a little bit later. His heart had been damaged from several heart attacks. The heart's become enlarged. The blood is just sort of swirling around in here. It's not a very vigorous pump. The blood isn't being pushed out. For Mr. Hernitz, he had blockage in all 3 of the major arteries that go to the heart and a branch off of one of them. 2 of the 4 heart valves were leaking in his heart, and this area of the very thin heart muscle had formed what we call an aneurysm, so that every time the rest of the heart contracted, that area was pushing forward. Because of that, he'd been told that he may need a heart transplant. We thought about that for a little bit, but instead thought that he would be best served by having a heart operation. And now we're going to take about a 5-hour operation, and we're going to show you the highlights of it. This is Mr. Hernitz's heart. Now he's on the heart-lung machine, and we're looking at the area that was damaged. On the heart-lung machine, we then stop the heart with this clamp, and we infuse it with a cold solution that will cool it down and preserve it. Right now, we're bypassing the left anterior descending using this vein graft and very thin suture about the size of a human hair. This is Mr. Hernitz's heart valve, his mitral valve. We put sutures around the heart valve, and then we put the sutures through this ring that we use to repair it. The way that works is that the ring is now seated around the heart valve. We used to replace heart valves, now we tend to repair them. Once this ring is placed, the heart valve itself comes back to the normal shape. Once the ring is there, we suture it in place, and then we test it. And we inject it, and then we look to see if the valve is going to become competent. This one looked good. We then went on to sew the vein grafts to the aorta, which is the big blood vessel that leaves the heart. He needed 3 of those in 1 mammary artery. We tie about 1,000 knots a day, so we get a lot of practice. So this is just another average day. This is his very thin heart muscle there that isn't contracting. We've now opened up Mr. Hernitz's heart, and we're using some sutures here, and we're reconstructing it. What we're doing is we're trying to exclude the area where the aneurysm was, and then we sew everything back together. He had one other heart valve, the tricuspid valve, that was leaking, and so we had to put another ring around that one that was specifically designed. Now, after all of the surgery, we start letting his heart do some of the work. And at this point now, his heart's starting to contract, his lungs are working, and we've disconnected him from the heart-lung machine, and now we're tying down the connection to where he had been hooked up to the heart-lung machine. So now he's off on his own, and now it's smooth sailing from here on.
With a defibrillator that has 2 wires inside the heart, one in the upper chamber of the heart, the atrium, and one in the lower chamber of the heart, the ventricle. The ventricular wire senses the rapid heartbeat and delivers a shock to stop it. In patients who also have heart failure and need the heart resynchronized, a 3rd wire is put on the left side of the heart so that can be paced at the same time as the right side of the heart.
Dr. Kadish then took Mrs. Chalmers to the operating room for one of these procedures to implant this biventricular pacer and a defibrillator. We'll see that now.
To put in the defibrillator, the skin in the upper chest is opened and a pocket is made under the skin to accommodate the wires and the defibrillator. 3 wires have now been advanced to the heart through the vein in the chest. One is in the right ventricle, one is in the atrium, and one is placed in the left ventricle through the coronary sinus. The wires are curled beneath the defibrillator to protect them during future operations, and the entire system is placed in the pocket that was created in the chest. To test function of the defibrillator, ventricular fibrillation is brought on by pacing the heart, and the ability of the defibrillator to stop an episode of fibrillation that would otherwise have resulted in death is tested. Dolores' defibrillator works beautifully, and the rhythm is restored to a regular rhythm. The skin is then closed, and the defibrillator...
to prevent heart disease. The most important, don't smoke. We mean it when we say that. First of all, smoking, if you have it and you have heart disease, it's like 2 + 2 = 20. They're additive. It makes it so much worse. Also, of course, it causes emphysema, lung cancer, other vascular disease. The first thing you could do would be to stop smoking. The second is if you have high blood pressure. That's a very big group. There's 50 million people in the United States that have high blood pressure or hypertension. If you have it, take your medicines, make sure you see your doctor, make sure that it's being adequately controlled, make sure that you're on the right medicines, and be very careful with it. The third is diet. Now, we could spend the entire lecture talking about all the different kinds of diet, but I always go back to what my mother said, everything in moderation. So we'll just move on from there. The next is exercise. We would recommend at least 4 or 5 times per week that you exercise for about 30 minutes or more. Finally, there's a new class of drugs called statins. These are drugs that are very effective at decreasing people's serum cholesterol. The cholesterol is what leads to the plaque that causes heart disease. If you're one of that big group that's a heart attack alumni, or if you know someone that has had a heart attack, there's also several things that you can do. First, all the same measures that we had talked about with prevention. But there's 2 classes of drugs, ACE inhibitors and beta blockers. What they do is they decrease the work that your heart has to do, so it makes it a little easier for your heart to contract. If you've had a damaged heart muscle, it makes your pump more effective. Also, we frequently recommend aspirin or some type of other blood thinner. If you take that, your blood doesn't clot quite the same. It's not as sticky. And so if you're at risk for having another heart attack, if you're on a blood thinner, it's much less likely to occur. Patients that have severe blockage in 1 or 2, sometimes 3 arteries going to the heart may be candidates for a stent. We used to do angioplasty. These days, it's mostly drug-coated stents that we're using. This is a patient who had about an 80% blockage. A cardiologist passed a wire across that blockage, put the stent there, blew a balloon up that opened that vessel up, and now you can see there's very brisk blood flow that can go there. That should relieve his symptoms. There's several other additional measures if your heart disease is more advanced. If your heart's really banged up, we may be suggesting a heart transplant, although we try to reserve that for only the very worst patients. On the other hand, it works very well. It's a miracle when you get it. There are these mechanical blood pumps that we're working on, and we're using them more and more frequently, usually for patients waiting for a heart transplant. It takes over the work of the heart, and these are getting better all the time. Someday they may end up just like pacemakers. In the future, there's a variety of treatments like cell transplants. Instead of transplanting the entire heart, we may just give tens or hundreds of millions of cells to patients who've had damage from that heart attack. They may come from stem cells, or it might even come just from a muscle, from the patient's leg. There's gene therapy. We can use that already to try to direct more blood supply into the heart, areas that aren't contracting well and aren't getting enough blood supply. Finally, there are these gene-designed drugs that we're starting to look at. We may be able to take people's DNA and then predict that you may do well on a certain drug or that you may not. You may develop side effects from it and it won't be effective. That's not that far off in the future to be able to do that. Now, you've been a great class. It's time for your quiz. What are the symptoms of heart disease? Chest pain. Shortness of breath. You guys were listening. Chest pressure or tightness, the elephant on your chest. Arm pain, jaw pain, possibly indigestion. This may be precipitated by cold weather, by exercise, sometimes a big meal. Some people say they can't breathe very well. If your heart's badly damaged, you may be fatigued, you may be tired all the time, and then your body may retain fluid, you may get leg or abdominal swelling. Now I'd like to take questions.
Doctor, my father had heart surgery a couple of months ago, and he is just not himself. Is there anything we can do?
Sometimes people describe depression after heart surgery. We see this sometimes. Early afterwards, it may be related to the anesthetic and to the narcotic and just the stress of going through the surgery. The other is that it's a huge life-altering event. Basically, it's scary. And so some people will respond to that and they may become depressed. Others become euphoric just because they dodged a bullet. If, however, a patient becomes depressed and if it lasts more than a few weeks, then we would usually be prescribing medicines to treat the depression. Another question?
Dr. McCarthy, I had my cholesterol tested last week. As a woman, is there anything else I should be doing to monitor my risk of heart disease?
Actually, there's a few blood tests that are really very helpful. Your cholesterol, of course, is very important, and also the subtypes, the good and bad cholesterol, LDL and HDL. But beyond that, there's one called CRP, or C-reactive protein, which is sort of a measure of inflammation in your body. And then there's a third that's called homocysteine that we're increasingly starting to check.
Doctor, I noticed on your list for cardiovascular disease prevention, number 1 was don't smoke. I was just wondering, what are my risks if I am exposed to secondhand smoke?
That's a very good question. I'm going to ask Dr. Kadish to answer that. As a cardiologist, I think that he would probably be best equipped to answer that. Alan?
Secondhand smoke can be almost as dangerous as regular smoking if the exposure is really severe. Regular smoking can increase your risk of heart disease 5 or 10 times. And secondhand smoke typically will increase the risk twice. So don't do it.
It's pretty serious.
I understand that women often do not have the same symptoms as men who are having a heart attack. Can you elaborate on that?
The symptoms that we had talked about really vary. First of all, many patients don't have any symptoms, especially people with diabetes. Women may have their symptoms a little bit differently. The other thing is that, frankly, women seem to tend to ignore it. I guess that they're busy doing a lot of other things and they tend to sort of put it off and they feel that they're the ones sort of responsible, and so oftentimes, unfortunately, they think that this isn't as prevalent in women, and so they tend to ignore it until it's already progressed quite far. Interestingly, the death rate for men from heart disease has been dropping the last several decades, but for women has been completely stable and perhaps even rising. And so we've made some inroads, but we need to do more with women's cardiovascular health. Well, now I'd like to thank you all for coming, and I also want to let you know I'm going to give you all honors.
Despite the best today's doctors can offer, there's no cure for any form of heart disease.
Here is another daughter branch coming.
Research is ongoing, and new clues are emerging, which could lead to better treatments in the future.
We've undergone a revolution in cardiovascular care in the last few decades, where we have an understanding of some of the problems that arise and cause heart attacks, and we have therapies that can address them in a very effective way.
Absolutely, you have survived.
But as far as we've come, with all of our technology, with all of our drugs, there's a lot we can't do.
The fight against heart disease has been going on for over 60 years. It started at a time when almost no one realized how big a health threat it really was.
The story of heart disease in this country is a very, very interesting story. Post-World War II, as our vets were coming back and re-entering the workforce, the Public Health Service made the observation that men in their 50s and 60s were dying of heart disease, and we didn't know the cause.
With the war over, federal money was freed up for projects at home. In an ironic twist, it was Vannevar Bush, the man who supervised the Manhattan Project, who pushed the government to do something about the new epidemic.
50 or 60 years ago, it already was known that heart disease was the leading cause of death in our country, but almost nothing was known about the root causes of cardiovascular disease.
In 1948, the U.S. Public Health Service launched a study of heart disease that would become a landmark in medical history. At the time, it was a completely new idea to follow a group of ordinary, healthy people for 20 years and search for causes of heart disease. The researchers chose the men and women of an unremarkable town outside of Boston called Framingham.
It was a beautiful little town. There were a very small population of people, maybe about 3,000 people, and no matter where you went, you knew somebody. There were no buses, and most of the time you walked. There were theaters, restaurants, ice cream parlors. All those things were there back 30, 40 years ago.
Like many American towns in the late 1940s, Framingham was a small middle-class community. Its stable population made it an ideal site to launch the heart study. The researchers hoped they would find clues in the medical histories of the people of Framingham, clues which might shed light on why so many Americans were falling victim to heart disease.
When the study began in 1948, neither the study participants nor the investigators who were working here had much of an idea of what eventually would emerge from this town of Framingham.
I took my first visit that opening year, 48, and it was outlined to us that they would try to determine what caused heart illnesses, and we all thought that we were fortunate to participate.
I thought it would be very interesting to find out what made everybody tick. My mother always used to say, you got to give back a little bit of what God gave you. And I think that sort of stuck in my mind.
In the early days, the Framingham Heart Study was simple. A lot of questions about family history, diet, exercise, and employment. Measuring blood pressure, listening to the heart, and some blood tests. And then, as the new study was quietly getting underway, heart disease suddenly made headlines.
A stunned nation hears that its president is stricken with a heart attack. The chief executive, ending his vacation, is rushed to Fitzsimmons Hospital, where he is immediately placed in an oxygen tent. The president's son, Major John Eisenhower, and Press Secretary James Haggerty go to the president's bedside, from which physicians issue cautiously optimistic bulletins. As an anxious nation awaits, newsmen converge on the press secretary for information.
President Eisenhower's heart attack was a dramatic and frightening event for the nation, because at the time, most victims of heart attacks died within days.
Back in the post-World War II era, the treatment for a heart attack was to put the patient to quiet bed rest for a period of weeks. We essentially would sit and watch the heart muscle die and try to keep the pain controlled with morphine and other kinds of analgesics and hope for the best.
On the lawn outside, photographers with telescopic lenses eagerly await the arrival of the convalescing president, whose biggest present is returning health.
It would take 6 weeks of hospital care before President Eisenhower could return to the White House.
It is Freedom Day for President Eisenhower as he emerges from Walter.
His heart attack had been a mild one, but even so, his survival was mainly a matter of luck.
Slightly drawn after the ordeal, the president presents a smiling and jovial face.
And there was a concept that it was an inevitable cause of aging and genetic makeup. That if you had a bad family history, that was it.
The original Framingham researchers refused to accept this simple explanation. Too many young Americans were having heart attacks for it to be a disease of aging, and many of them had no family history of heart trouble. The researchers began to ask probing questions. Were there specific scientific causes of heart disease? And if so, how could they find them? This was a challenge like nothing before. As the Framingham researchers entered uncharted medical territory, they discovered profound changes in the patterns of daily life in the U.S.
In the era of post-war prosperity, there was a great deal of emphasis on leading an easier lifestyle.
She knows that once she sets the controls, the range automatically does the rest.
We did everything we could back then to engineer exercise out of our lifestyle.
Dishes, dishes, dishes.
Why can't something be done to relieve the monotony of this everyday kitchen chore?
Something was done about it. The new automatic dishwasher.
We invented lawnmowers that instead of being manual push lawnmowers were now electric operated. We removed the old manual washing machine and wringer dryer and replaced them with automated devices.
In America, millions of people drive automobiles, big ones and little ones.
Every family started to have a car. And the next thing we know, 2 cars. And people, when they wanted to go to visit their neighbors who lived 3 blocks away, would drive. Now, previous generations, they'd walk those 3 blocks. May not seem like much, but multiply that across millions of people across the country.
And the second thing that happened that made us a sedentary society was the invention of the television.
A major segment of the mass television audience is children. And for the youngsters...
Television is the great antidote to exercise. And we led to whole new terms like couch potato.
Finally comes the time when we're ready to eat. We always give thanks.
Another important change was the change in the American diet. Having lived through the Depression and then the rationing that occurred during World War II, the post-war period was characterized by a sense of entitlement. We earned or deserved the right to enjoy a little bit of indulgence. And the entire American diet began to become a much richer, heavier, fat-laden and cholesterol-laden diet.
8 contestants, all in top shape, come face to face with 4 mouth-watering tenderloins, and they're off.
And we began to get fatter and eat more fat. And there's actually one more trend. During the war, the government issued cigarettes to every soldier. They were one of the few perquisites that a soldier could have, as you're given a pretty good ration of cigarettes, and virtually everybody in the military smoked.
You'll get a chance to try his hand at the job.
And they came back, and they actually introduced, and women began to smoke. And before the war, women rarely, if ever, smoked cigarettes. We got to the point where we were fatter, eating more fat, exercising less, smoking more, and all of a sudden there was an extraordinary epidemic of heart disease.
The Framingham researchers were making these same connections as they studied their volunteers. After 13 years, in 1961, the heart study reported its first major breakthrough. They isolated 3 key factors that could lead to heart disease: high blood pressure, high cholesterol, and smoking.
Perhaps the greatest legacy of the Framingham Heart Study was the early recognition of links between certain traits and characteristics and the development of disease later on. The emergence of this new concept of risk factors changed the whole equation of how we approach heart disease.
The concept of risk factors, taken for granted today, was a revolutionary finding. Now that they knew that blood pressure, cholesterol, and smoking were somehow connected to heart disease, they had to go on to figure out how.
We hope that members of our society, our population, our public, know those risk factors as well. But denial still is a major factor that prevents many of us from recognizing the symptoms of heart disease.
One of the most frightening realities of heart disease is that it can hide silently for decades without any symptoms at all.
He's always been larger than life in everything. You know, he's always the life of the party. You know, he walks in the room, he takes a room over. He's just got that kind of a personality. When Tom Brokaw wrote the book, The Greatest Generation, he left one person out, and that was my dad. He was in D-Day, in Wave 1 of D-Day. He was in Palermo Bay. He was in Africa, in North Africa. On all of these major invasions, and you think to make it through one is a miracle, but that to make it through every one of those was amazing, absolutely amazing.